Welcome to the CTV Evening News on Calabash TV and on the Wave Radio 94.5. I'm Valentine Dantes in for Lisa Joseph. The Ministry of Health, Wellness, Human Services and Gender Relations has engaged the services of 2 consultants from the European Union project to research options for financing of the healthcare system into the future to build a sustainable healthcare system for St. Lucia. Zeister Edmund, Chief Health Planner with Ministry of Health, noted that a health financing initiative has always been part of the ministry's strategic plan for health. The Chief Health Planner noted that more importantly, universal health coverage is tied to the whole issue which the ministry believes is necessary in healthcare, that of fairness, a coming together to provide health coverage for all, as well as effective and efficient use of the investments in health.
We have to make sure that we understand what causes our people to be sick most of the time, and that we ensure that the interventions that have been identified are tied to trying our best to address those issues. This is what universal healthcare sets out to do. 2 components of universal healthcare are, firstly, there is need for health financing strategy. You must have a health financing strategy so that it is not free. There must be a way that once we've costed the package of services, we will then have to establish how are we going to go about paying for that package.
There are 7 components in the establishment of universal healthcare. These include governance strategies, the actual services, financing, quality management systems, health information systems, infrastructure, and evaluation. The consultants engaged by the Ministry of Health include an actuarial scientist and health policy consultant for universal health coverage.
We have already commenced the costing of that package. The real work of the actuarial scientist is to identify the capacity of the economy to finance the initiative of universal healthcare and to determine to the government of St. Lucia the best strategies moving forward in financing this care. There is always need for clear policy direction. Therefore, universal healthcare needs clear policy direction and also appropriate legislation. So the second consultant will be working with us on that second component.
John Armstrong is the consultant actuarial scientist to the Ministry of Health from the European Union project. He pointed to his experience of working with other countries in the Caribbean area to look at the actuarial analysis of healthcare systems and will be doing the same for St. Lucia within the next 6 to 9 months. Armstrong explained the processes which will form part of his analysis.
The key aspect is obviously the demographic profile of the country. What is the size of the country? What is the makeup in terms of the age profile, the male-female split, and where people live, the socioeconomic wealth of the country and issues such as that. So that'll be a key part of my work to look at these aspects. The second will be then to look at what are the expectations and the package of benefits which will be provided in the healthcare system and which needs to be provided, and to look at really the cost of provision of those packages. The project will be completed in the next 6 to 9 months. We are envisaging that we will then present a number of policy options for the Ministry of Health to consider. Those policy options will hopefully look into the next 5 to 10 years in terms of the profile of the population and what the cost of provision will be in the next 5 to 10 years. A key part, as obviously, is to understand what are the expectations of the population in terms of healthcare, what are the plans of government and plans of the ministry, and to really factor them into our analysis.
The consultant noted that on the completion of the consultancy, he envisages that they will then be able to present a number of policy options for consideration to the Ministry of Health.
There has been a considerable body of work done before by the Ministry of Health, the previous international experts, and a lot of that work is really excellent work to look at and work to the future. We then will actually, meet many of the important stakeholders in the system. Some of the medical profession, some of the financiers already in the system, and obviously as part of that, we will talk generally to consumers and people who use the service, because a key part is to understand the service that is currently provided and what people's expectations into the future are.